Crystal. I am Joshua Perry here, just trying to be a podcaster like everybody else in the world.
Right.
And I'm scared.
Okay.
So where are you from?
I'm from Springfield, Massachusetts.
Nice. We did some events up there.
Yes, you did. Mass Mutual.
Yeah, were you there?
Yes, I was.
Oh, fantastic. Well, thank you for coming out. That's great. So, and now we're at Cigna at beautiful Bloomfield, Connecticut.
Yes.
Had you been down here before?
Yes.
Yeah.
Yes, I'm familiar with Bloomfield.
Okay. So as a hygienist, it's overstated. Be here, be there. You kind of.
Yes, I'm licensed in both states.
Any others as well?
Just Massachusetts and Connecticut.
Okay.
I know.
We'll have more locations. But yeah. So you're a hygienist.
Yeah.
How long have you been doing hygiene?
21 years.
Yeah. I don't know anything about it, but like, is that?
It's just cleaning teeth, but you know, it's one of the most dangerous professions.
Wow.
Yes.
Is that
because
right?
of, a lot of bacteria, a lot of
and also, as you say, you're kind of
in there.
You got to really get in there, right?
It's funny because my hands are strong when I'm cleaning teeth, but anything else, open a jar. No, that's hard.
That's like muscle memory.
Exactly.
Like it's from doing it. So.
Exactly.
But so I mean, so a single day.
5 days a week.
5 days a week.
Sometimes 6. Yeah.
I
love it.
You love it.
Mm-hmm.
Well, that's good. Okay.
I did that for 10 years. Back to hygiene. I went back to school for hygiene.
So you did dental assisting.
Yes.
School. I bet you were doing it the same.
Dental assisting, working.
Yeah.
It took me 10 years to go back.
Okay.
And then I had prerequisites that 2 years.
Yeah.
And then 2 years of hygiene school.
But I'm just guessing. You probably you were working while you were doing classes.
Absolutely.
Yeah.
Mm-hmm.
Bravo. You didn't have also the kids to.
I had one child.
At the same time.
Yeah. It takes a village, but I did.
Yeah, I bet.
Mm-hmm.
Yeah, I bet. Well, that's great. So you've been in the dental field for 10 years. You go back to school, cranking away, working at the same time, taking care of baby, and be a hygienist, and still working 5 to 6 days a week.
Yes.
Wow. And do you normally work in a fixed site practice or?
Yes.
Okay.
Yes.
That's
I mostly work with kids, but adults as well.
Okay.
Mm-hmm.
All right. Which is more work? What's it? Our kids.
There you go. That one.
Yeah. I hear you. But it's and you gotta keep them entertained.
Exactly. You gotta, learn how to talk to them and keep them engaged and, as well as, informing them about how to keep their teeth healthy.
And how do you maybe for these regular patients that you've had, how do you get dental hygiene? Is it education? Is it, do you feel like there's you got a little secret sauce there for trying to get people to be more proactive about their healthcare?
Well, you kind of gauge the patient, as you're talking to them, kind of meet them where they are.
Yeah.
Be really realistic with them.
Yeah.
Don't get too technical.
Yeah.
So most people, that's what I'm here for.
But that's your job.
If they don't.
You don't want to be too good.
Exactly. Right. But I also like to tell patients when they're doing an excellent job, you're doing awesome. They like to hear that too. Mm-hmm.
You need. It sounds like you need, is that positive reinforcement. Exactly. But you need to be honest.
Mm-hmm.
You got to be honest, saying, but you got to. I say go New York on it. But it's like, hey, this is what's going on. But okay. Now this, and I actually at Mass Mutual, and now here at Cigna headquarters.
Yes, I did. Marlborough, Massachusetts last week.
Okay.
I like the new pod. The equipment is much better. Yes.
Yeah. Good.
Temperature, the AC could be a little better, stronger.
Yes. Okay. We put the new wrap on. Hopefully that'll keep it a little bit. But I don't know if it was.
Today's kind of the best day.
Oh yeah.
Yeah. Today I felt good.
Okay.
But
yeah. Okay.
Maybe your profi
be a little strong
angles. Yeah, because now you have the new unit, so you can actually get the ones that we can put on the unit and sterilize after every patient. Okay. And it's a lot stronger.
Okay.
Than the cordless.
Ones, the cordless. Yeah. It's like and this is
it's like I'm just going like
right. Yeah. And I'll tell you, that's the thing. You got to have a lot of different options. There's a lot of different providers on.
Yes.
And maybe some is personal preference. Some is, some is better equipment than others. But I've realized you got to have a lot of different options
Yes.
on site. Um,
And you got to keep up with, the
yeah,
latest.
yeah, yeah. I mean, technology, it's
Mhm.
so quick. It's
Mhm.
funny. I was thinking about this. Is that there's there was this like the Empire State Building
Mhm.
was like, and I'm gonna butcher this here, but like the Empire State Building was built in like 2 years or something, some crazy small amount of time, and
Mhm.
the average building today takes like 10
Yeah,
years to
exactly.
build. Or if you're talking about airplanes today are pretty much the same speed, whatever, as
Mhm.
they've been for the last 30 or 40 years. But then there's technology like dental, and there's just amazing technology, whether it be the analyzing with AI, X-rays versus dental equipment for hygiene. Yeah,
Mhm.
you got to stay really knowledgeable about the
Yes.
good stuff that's coming
Mhm.
out. Okay, well, I don't know. I probably could ask you 50 more
I know.
questions. But what do you think so far? Like, is it good? Like,
So
we
far,
got
it's good
additional.
at July.
Okay, July.
I love the mobile. You have to meet people where they are. So,
Oh, that's good. Where are we going in July?
Slime Meadow,
Okay,
Massachusetts, right next
Massachusetts.
to me.
Okay, very good.
Yeah.
Then got you on this one. But it always, of course, is to say, please let us know how we can be better
Mhm.
for you. Because at the
Mhm.
end of the day, we have our patients, we have our relationships with the
Mhm.
workplaces, but we can't do any of this without you. Well,
Appreciate that.
I mean, we need to get better. And okay, well, I think that's a wrap.
Awesome.
Thank you.